Hello, this is Pam. The topic today is part 3 of research showing the connection between multiple sclerosis and malaria. And this is the third part of a 3-part series. This will be the last one where I've really uncovered a lot of lost research that is very, very significant for those of us that are dealing with multiple sclerosis, because we all want to know what is causing this horrible disease. And what I have discovered is that there's at least well over 100 years of research linking multiple sclerosis to malaria, where a lot of researchers in the past and doctors felt that MS was caused by malaria. So just as a disclaimer, I'm not saying that all MS, that is the only parasite that can cause MS, but it looks like for a lot of us that this could be a really big piece of the puzzle. So in part 1, I shared what a protist is because we want to know what malaria is, what kind of a parasite it is. So it's a single-celled parasite. It's not bacteria. It's not a worm, and it's a protist. And with malaria, it's called Plasmodium. And we talked about research, quite current research that came out of the University of Calgary, that's Alberta, Canada, just in the last few months, where they were giving MS patients that had primary progressive multiple sclerosis, they were giving them hydroxychloroquine, and they were finding that over the course of a year and a half that they had a significant decrease in the progression of disability. They could measure it and compare it to control. So that's really, really significant. And what I would love for you to do is, if you enjoy these topics, please share this with others. You are the foot soldiers. You are the only ones that are going to help bring this truth out. So I'm doing all the research. I'm doing the hard work, the heavy lifting, getting all the information together. And then if you could send it out to others, other groups, people that you know are looking for this information, maybe certain practitioners or groups, because we have to help this whole movement to move towards dealing with the cause of MS so we can get our health and our life back. We can recover from the parasites once we learn, but we want this to end for everyone, because we know what it's like, myself included, to be diagnosed with MS, to suffer with these parasites, to have these horrible, disabling symptoms, and then to recover. So we want to bring an end to this misery. Malaria and Babesia are both protists, single-cell parasites. So you may have heard of Babesia. It's one of the vector-borne infections. So we're talking about malaria, but they're very, very similar. So maybe you don't have malaria, and there's also different species of malaria that we can have. So they're cousins. But maybe we have Babesia and we don't have malaria, but they're single-cell protists that these ones will infect our red blood cells, and I shared in the part 2 of the video series. So if you haven't watched them, make sure to go watch them later on. I shared, number 1, just the similarities of, the distributions of the old malaria maps versus the distribution of MS. And we also talked about how the author was sharing the findings of where they found antibodies to malaria and also the malaria parasite in MS patients, but not in healthy controls. So they always do a control, they always will, a good study will take a group of people that they're testing, but then they'll take people that don't have it and they'll see, was the malaria or the parasite or the antibodies in both healthy people and MS? And no, it was just in the MS patients. And so through the findings of, looking at the United States of where MS is located and where malaria was located, and I didn't know that malaria was a thing in the United States. I thought it was just in tropical climates, but I learned a lot through this. So their conclusion was that an infection with these malarial parasites in early childhood. So if we got sick, so if we were in an area in the United States or other countries, so this is European countries, etc. I haven't got much about Canada yet, I don't know, but in European countries and probably in Canada too, but in European countries and also in the United States, if there's an epidemic of malaria and people, as a child, we get the infection, then we have immunity to it. But then as the epidemic is being treated, then it's not like the malaria goes away totally, because the mosquitoes are still carrying malaria. So in time, maybe if we treat enough of the population, then it's not going to be an epidemic, but it's still present as a silent infection. So mosquitoes can still have small numbers of the parasites in them, which sometimes will infect us and sometimes won't. We'll talk about that in a minute. But then if we don't have immunity against malaria and we become infected by a mosquito that has the malaria parasite in it, then we can have this silent chronic infection of malaria. And I believe, this is just my own personal belief, is that like for someone like myself, I had dysbiosis for many years before I came down with the neurological symptoms of MS. I had gut issues, gas, constipation, stomach aches if I ate Chinese food when I was a kid, and a lot of constipation. Couldn't eat hamburgers, Chinese food, always, would have to lay down, and I had a stomach ache. So those of us that have dysbiosis, it taxes our immune system. And then I'm just like, as I'm doing this research, I'm like, I actually went down to New Orleans, and I've been to Europe and I've been to Africa. Way back when I was young, before I was diagnosed with MS. So did I get, could I possibly have got it here? Could I possibly got it when I was traveling a little bit? I don't know, but it's really fascinating. It starts to really make you think. So make sure to type your questions in the question box, and I'm going to come back to that after. So part 3 is today. And so there's a 2-part study that Kistler, he's the author, he's a researcher, and he's put this information together. So I'm just pulling it from his studies. There's a part 1, which I did last week. The title of that is called, Is Multiple Sclerosis Caused by a Silent Infection with Malarial Parasites? Historical Epidemiological Approach, Part 1. And then this part 3 of my talks, of my videos, is going to be discussing part 2 of that study. So he has 2 full studies on this. And I'm just going to scratch the surface. There's so much information in there. And so again, talking about the geographical distribution of multiple sclerosis, it could be what they feel and what they're theorizing, their belief is that where MS is distributed, it could be understood as the result of a steadily declining immunity against different types of the Plasmodium protist that causes malaria. And that was beginning in the middle of the 19th century, first in the mountain areas in Northern Europe. And again, I didn't know this. I thought it was just like a tropical disease. And about the end of the 19th century in Northern America, and gradually spreading to the south. So the transmission of malaria, it doesn't stop when the epidemics are treated, okay? It will decrease it a lot, but it doesn't just, like if we treat the humans that have malaria, that doesn't mean all the mosquitoes that were infected with malaria are no longer going to infect people. And the distribution of malaria keeps to its former pattern over longer periods of time. So it's basically, where it has been present as an epidemic, it still is often present, but at a much lower incidence, not as prevalent. And for malaria to be transmitted, the temperatures in the summer have to be at least 15 degrees Celsius or higher. And the author talks about the distribution of malaria in countries like Sweden and Finland and Italy and a lot of other countries, which we're not going to talk about because we'll be here for a long period of time. But I didn't realize that malaria was present in all these different countries. So let's just talk about Switzerland, because they have spent a lot of time really extensive stats concerning the distribution of multiple sclerosis in Switzerland. And malaria has been epidemic mainly in the southern part of Switzerland, where they had significantly fewer cases of MS. So if there's an epidemic of malaria, if malaria caused MS, then you would think that it's going to be treated a lot more aggressively. And so then you would probably find less cases of MS. So you're finding, according to their theories, you would find less of the silent infection. And when I say silent infection, it means like you're having a chronic infection of malaria, not an acute, where you have the high fever and all the symptoms and you're really sick and you go to the doctor and they know in those areas to treat you because they're treating other people for malaria. So It is assumed that the epidemic malaria did not disappear completely from Switzerland, but it changed from a clinical, so that's the, where the doctor recognizes all the acute symptoms, to a subclinical form, the chronic form. So in 1970, a couple of different researchers, they published a paper about the seasonal, and this would be really interesting to follow up on if any of you love researching, but to really look at the seasonal incidence of bouts of MS in different areas of Switzerland. So they were looking at the seasonality of MS, and they found that they had the greatest number of MS cases in the spring and very few in the autumn seasons. So there was a very significant difference between the number of people that were diagnosed in the spring versus the people that were diagnosed with MS in the fall. And this phenomena was, so what they discovered was consistent with another researcher who looked at the seasonality of malaria, again, finding that it was consistent with the seasonality of MS. And then another thing they found is that at high altitudes, there is little to no transmission of malaria, which would make sense. If it's very high altitude, the mosquitoes, it'll be too cold and there's not going to be a lot of transmission. So it's not that it's totally gone, but it's less, right? And if there's less transmission, there's more opportunity for the chronic infection, the chronic malarial infection. So malaria could not be found in Germany above 400 to 500 meters, which means that at higher altitudes, you would think that the MS would be higher incidence because there would be less immunity. There might be more of the chronic infection, the chronic state there. And in fact, they do find a positive correlation between MS and altitude. So it's not just your distance from the equator, because that's what I always thought it was. I always thought that it just had to do with, in Canada, we're at a certain latitude. I can't remember those latitude or longitude, but we're at a certain distance from the equator, and then some of the European countries would be similar, and that was the reason for the higher incidence in MS. But in Kistler's collecting all this research, he's found that no, like in certain areas that are maybe not as far away from the equator, but maybe some of the citizens live in mountainous areas. So it might be like in the valleys, it might be a lot warmer, but if you live in a mountain area up higher and you're still in that, like closer to the equator than, let's say, Canada, then there is a higher incidence of multiple sclerosis there. So they would feel that, so for example, with states like Montana, Idaho, Wyoming, Oregon, and Washington, they have mountains in the areas. This was true for towns also in Norway, Czechoslovakia, Sardinia, and also Italy, where the altitude of the town was really important with respect to the incidence of multiple sclerosis, but also the incidence of malaria will be less in higher altitudes. So again, it's not just how far you are from the equator, but now it's like, oh, well, it's how high you are up, where the temperature will be cooler and there will be less chance for transmission. Not totally gone, but less chance. So they were saying if somebody was born and raised in a town which was in a higher altitude, so much higher up, cooler climate, they probably didn't acquire immunity to malaria. And then if they left those smaller mountainous towns and went down to a lower altitude where they maybe went to school and got a job, etc., then they were exposed to a higher malaria transmission. So they're saying that just because we don't have the epidemic of malaria doesn't mean that we don't have malaria in our society. It's just more of this silent infection. So we're ignoring it. Just like we ignore roundworms and we ignore tapeworms and we ignore flukes and we ignore fungal infections and we ignore Clostridia infections, we ignore malaria. So it's not too hard of a stretch to believe that because we're told that we don't have parasites in developed countries. So in treating malaria, if you have a mosquito or another insect that is lightly infected with malaria, then it may not cause the disease inside of us, or we may have it may be triggered a little later and just be a chronic infection. So they've said that even with very low-grade parasite infections, where they were not able to, so malaria parasite infections, where they weren't able to find these gametocytes, so the very immature form, and they did examinations in blood, they sometimes were still infected with the malaria plasmodium. So it's challenging for them to see that also. And we'll talk about when they were giving them quinine, then all of a sudden the parasites show up, which is crazy. So with a high prevalence of multiple sclerosis in the mountainous regions, when the logical conclusion would be that a real epidemic of malaria should in any case be followed by an increase of multiple sclerosis. So what they're saying is that, again, if people are living in high altitudes, they will have less immunity to the malaria parasites because it can't live there as well. There possibly could be some, depending on how high it is. And then we are more susceptible to having, as an adult or a teenager or as an adult, we're more susceptible to getting this silent infection of malaria. So they looked at Mississippi and they found that in Mississippi, because they have a lot of flooding. So in the year 1903, in the year 1912, and again in 1913, they had a lot of floods. And so with a lot of floods, you get a lot of mosquitoes. And then they had this epidemic of malaria that followed also. And again, malaria follows extensive flooding because you have more mosquitoes, and then the more mosquitoes and the moist climate, it's perfect for the transmission of malaria. So then they found, so different researchers found that, between those years that the rate of malaria, the incidence of malaria increased significantly. I think it went up to like 30%, it increased. Mississippi showed by far the highest percentage of positive cases with 31%, while the average of all other states was about 13%. So malaria was still present in the other states, but because of the flooding, it was so much higher. And so then he felt that could help explain why they found a higher incidence of MS following that, like later, in men that were drafted into the army. So there's this connection between MS and malaria, like in different states, in different countries, over different years. And it's not just that, but it's also with MS, they're finding that they found antibodies against malaria in MS patients. They're also finding that they find the actual parasites of malaria in MS patients. And so they're finding, and I'll finish with that, is that treating MS patients with quinine, which is a malarial drug, that they had significant benefits. So it is kind of complicated because it's kind of like the opposite. It's like, if there's a high incidence of malaria and they treat it really well, and then following that, then the immunity can wear off. It's still present, but when they're treating the high incidence, that's when they found low MS, because they're treating a lot of people even that could possibly have MS with the malarial drugs, and they benefited tremendously. So, and also if you don't know you have MS and it's malaria and you're treating it early, then it would rectify it and you didn't even know that you had MS, which was really malaria. So that's the whole premise of what they're saying. Treating MS with quinine. So this is the drug that treats malaria. So here they had cases that resembled multiple sclerosis, for which they must have been caused by malaria, but they were cured by quinine. So there's one researcher in 1917, and what he shared is, I have seen one case in this area and 3 in the tropics of a malaria condition closely simulating like disseminated sclerosis or multiple sclerosis. So they had the symptoms of MS scanning, so speech problems, tremor problems, muscle twitches, spastic gait, increased reflexes. All of these were cured by giving them the malarial drug quinine, Quine. So they were saying just because these people responded really well to quinine doesn't mean that they had genuine MS. So what happened is they just basically thought that was just a fluke. They had malaria, they had symptoms like MS, but they actually didn't have MS because they were cured by MS, but with MS you wouldn't be cured by quinine. But that research has never been followed up. That's the problem. But then later in 1963, another researcher, he included quinine in a list of 25 different treatments that he had significant successes with in treating MS. And at least 3 different doctors, also all distinguished by their experience, had also had positive attitude towards treating MS with quinine. So in 1963, there was a doctor and also other 3 different authors also believing that quinine was helpful for MS. And then Mueller emphasized that quinine is useful in cases of MS, especially if the disease shows general symptoms of central nervous system symptoms like vertigo, for example. So that's Mueller. And then Marburg, an important promoter of MS researcher in Germany in the 1920s, he treated MS with quinine, which he found to be helpful also. And then Bricker in New York, who treated 50 MS patients over 5-year periods between 1930 and 1935, his conclusion was that the experience of 5 years with 49 patients seems to justify the conclusion that quinine is beneficial in cases of multiple sclerosis, especially in the early stages. He explicitly stated this again, a general view of the present status of the 49 patients as individual strongly indicates that quinine therapy has been helpful. They also found that this has to do with the Herx reaction. So I have a much better appreciation of the Herx reaction after looking at this. So the Herxheimer reaction was first, I'll have to look deeper, but it looks like it was first acknowledged by a researcher or by scientists where they were treating syphilis. And I've talked in previous videos about how syphilis is, just like malaria is so similar to Babesia, well, syphilis is very similar to the bacteria that causes Lyme disease. So they're part of the same family. And it was known that years and years ago, when they treated syphilis, that sometimes people could have this very strong reaction. And so that's how the Herxheimer reaction name came into effect, where you get like a bit of a cytokine storm. You might get you might feel worse before you feel better, a lot of symptoms. So Bricker stated in 1932 that in some cases, so when he was treating MS patients with quinine, he noticed a slight regression of some of the symptoms at the beginning of the treatment, but then that later, like once they recovered from those Herxheimer reaction type symptoms, then they later had significant marked improvement. And so that initial slump, so basically you're giving a treatment and then the patient feels worse, he felt was a favorable sign of that drug. And again, it was well known that this Herxheimer reaction can be a result of treating syphilis with different therapies that they used, whether it was antibiotics or others. So again, it is remarkable that quinine, and this is really interesting, so that somebody who looks like they are, like they don't have malaria, but due to symptoms, et cetera, like maybe MS, they're treating MS, and they give them quinine, so they may not find the malaria parasite in them before they start treating, but as soon as they start treating them with quinine, if somebody has a chronic low-grade infection of malaria, then all of a sudden the malaria bacteria or the protists, they're not bacteria, the protists show up and people can have symptoms. So Craig's conclusion in 1917, researcher Craig, without having a single parasite, a malaria parasite, he concluded from feverish reactions after giving quinine observed by him on a patient suffering with MS. So there's an MS patient and he gave that patient quinine, developed a fever. They could not find a single parasite before, and they gave them quinine, the patient developed a fever, and he believed that that patient probably had malaria due to the reaction that patient had when he was given quinine, because that's what they know what happens with these chronic malarial infections. And then in 1921, another researcher stated that the injection of small doses of quinine, again, a malarial drug, had become a well-known method of treating malaria. And when they did that, it showed parasites for the first time after the administration of quinine. So for people that don't have like acute clinical, where they can really diagnose malaria, but maybe they're treating MS thinking that might help, then they start administering quinine, and then all of a sudden the parasites start to rear their ugly heads. And they're not as prevalent in the body as if somebody's dealing in an area of epidemic. But it's interesting how, so that would also, like when you look at the research for MS, when they found maybe 20% of people that had MS showed parasites, maybe it's a lot higher. Maybe they were not able to detect them because they're hidden, right? They very often live in our red blood cells. They might live deeper in our tissues, etc. So it could be much higher. So this is really interesting. It'll be really interesting to see, which people take this to their doctors and which doctors will help their patients and really try to see if treating malaria is going to be really helpful. Again, my suspicion is that it's really important to treat dysbiosis too, but maybe for some people, treating malaria at the start will give them, kind of get them out of the danger zone of their symptoms. If they suspect malaria, but they can't pick it up, they give them quinine, and then they quickly look to see if they can find parasites in their blood. And so it seems to, and also the fever, like if they get a fever. Thank you so much for your comments. Again, if this is new to you and you want to research this more, Live Disease Free on YouTube. I've got a lot of videos there, and also on our website, Live Disease Free. And if you're start to change your diet, you'll start to notice a huge improvement. Again, if for the person that is worried about, the negative Lyme, start to follow the diet. You will see that you will feel a lot better. And then learn about the infections. If you need support, if you can't find a doctor that will help you, reach out to us. We've got different levels of program to help at different, some people want full support, some people want more of a self-directed support. We will help you wherever you're at, and it doesn't matter what country you're in. This is a skill that you have to learn so that you can actually play a really big part in your recovery. That's the only way that you're going to recover. So with that, I'll be back next week talking more about parasites. And again, just make sure to subscribe to our YouTube channel, and please share this if you found it helpful. And we'll talk to you next week. Take care and bye-bye for now.